Insurance is about assessing risk and actuary tables. And if you fall
But
out of
I
the
but I
norm,
agree
you're
with
done.
George about screening for adult onset conditions. And actually, I discourage patients from screening for certain adult onset conditions because of that. Or I tell families, look, before we're going to do this for this adult onset condition, I want you to think about this issue. And if it isn't affecting your child's health and wellness right now, I think you should wait. And at the point at which they're, whether it's reproductive age or we need to know it for contraceptive use or whatever, then we will consider screening. So I agree with you, George. I'm not disagreeing at all. But I feel like for these particular conditions, because of the early onset of symptoms, it's not going to be as relevant.
Now, Molly, what do you think pediatrics will look like 10 to 15 years from now with all the different new, I don't know if they're new diseases, but more predominant diseases that we're seeing now that infectious disease is gone and
Not in
ability
my
to,
office this summer, I can tell you that. I've seen more pneumonia this year than I have seen in my practice life ever. But I agree with you
this
overall.
genetic stuff that we can do and all these
Yeah.
wonderful therapies that we can start early on. And then all these immune modulators that we're using. Well, what would it look like 10 and 15 years from now?
I have my, I hope it looks like and what I think it will look like. I don't know about you guys, but my practice right now is a lot of mental health right now. And I'm hoping that as we become more knowledgeable about the biological, genetic, and family systems and social network, all the things around mental health, that becomes less of an issue in 10 years. And although it's still always going to be a part of our practice because disease is disease, that it is less of a profound part of our practice. I do think there will be 10 years might be a little bit of a short timeline, but I do think that we will see more very personalized medicine, people having adults and children alike having more understanding of how medications interact specifically with their metabolic personhood. And we already can do some of that with regard to mental health medications, especially SSRIs with pharmacogenetics. But I suspect we'll have even a better understanding of all that. I think the gut microbiome is going to become a major player in the way we manage infant colic and the way we manage eczema and food allergy prevention from starting from birth and moving forward. I think it's going to become a much bigger player in medical management going forward. And our understanding of it will become much more nuanced. It won't just be when things are out of whack, but it'll be a more proactive approach in our health understanding.
I think the microbiome is going to be fascinating, not only in mental health, but metabolic disease, obesity, type 2 diabetes, allergic conditions.
Yeah,
I think we're not even seeing the iceberg. We're just seeing the little
I
tippy
agree.
top.
I agree.
Nobody's
And looking at
going
the
down.
data around
Yeah.
colic and the gut microbiome is fascinating, actually. Looking at babies who are colicky at 6 weeks and looking at the adjustments and reduction in symptoms. And it's interesting just to see. So I think there is quite a bit we still have to learn. Looking at the reduction in food intolerances and allergy predilections, I think there's a lot there